So I commonly see the full spectrum of skin cancers, in particular basal cell carcinomas and squamous cell carcinomas. I very occasionally see people with issues around pigmented lesions and do excision biopsies for malignant melanoma as well. As a sarcoma surgeon, I also get referred a number of patients with pleomorphic dermal sarcomas and cutaneous sarcomas as well, and I'm very happy to manage those. The distinctive characteristics of any skin lesion that people are worried and concerned about are essentially any change in it. So particularly if it starts to grow and get bigger, or a lesion that is a polka dot and turns into a little bit of a smudge, so has a distinctive border that then starts to blur. Or you can have a lesion where it's pigmented and then the pigmentation starts to change, and either can be eroded or it can get lighter or darker. And those sorts of things, any change in a lesion is something that we would want to see you about. Because in the clinic, what we then do is do a full top-to-toe examination of you, understand your skin type, look at other lesions that you may well have, and then be able to examine them in great detail, in particular using a technique called dermoscopy, which essentially is a fancy magnifying glass with polarized light, which allows us to look at some of the distinctive characteristics of the lesion themselves. Well, these lesions, that is skin cancers, need to primarily be managed safely. That is to make sure that they are removed for biopsying and analysis, and that they are completely cleared to minimize the risk of not only local recurrence, but where appropriate, spread to other areas of the body. Then making sure that patients are kept under regular follow-up and skin surveillance, and that we're able to repeat that top-to-toe examination and that very detailed analysis of lesions in the clinic with dermoscopy. There are a number of different risks and complications. Fortuitously, they are relatively low because these lesions in the main tend to be quite small. The vast majority of them are treated with surgery, with often excision and direct closure. Very sometimes we do little local skin flaps to reconstruct people, and sometimes we need to use skin grafts. If there is always a risk of bleeding and infection, and some people's medication may well slightly increase that risk. Other things such as diabetes or poor sugar control can also delay wound healing. And we've got a dressing clinic, and we see people very, very regularly there to support them in that healing process. And then we're regularly following people up back in the clinic to make sure that not only they're optimizing healing and we're giving them the appropriate amount of advice, we're also reminding people in terms of their exposure to ultraviolet radiation and carrying on that essential skin surveillance.